Hi everyone, thanks for joining us. We'll get started. My name is Kate Lardner. I'm a medical doctor and co-founder of Healthy Futures, an organisation of healthcare workers and community members working to address the environmental determinants of health. Thanks for taking the time to join this evening. We have a fantastic lineup of speakers that I will introduce you to in a moment. First, I want to acknowledge that the land we all stand on is Aboriginal land, and that sovereignty of this land was never ceded. We must never forget this and keep it in mind in all of the work that we do, particularly when working to address air pollution in Gippsland, a region belonging to the Gunai-Kurnai people. Air pollution is a complex issue. Many people are here tonight for different reasons, whether that be concerns about climate change, bushfire smoke, wood fire smoke, the Morwell mine fire, to learn about the issue in general or to learn about how to take action. So let's respect and utilise that diversity. The multifaceted nature of air pollution means that we can all contribute to the solution with our different strengths and work together in solidarity to address this issue. What we do all want for ourselves, our children and our loved ones is to be breathing clean air. It is not too much to ask to be able to live with pollution controls and standards that other developed nations simply take for granted. This is Australia, and this is the year 2020. We do not need to see death and disease from air pollution in this day and age. The technology and solutions are there. We need to develop a powerful collective voice to see them implemented. The purpose of the session tonight is to understand the air pollution problem here in Gippsland, which is complex and can be confusing, to connect with others and to continue to build on these connections after the forum, and to leave the forum with a clear idea of how you can get involved. On to housekeeping. There's a lot to get through in a very short amount of time. This is an hour of power. We've put a lot of time into organising it. The speakers have kindly given their time to be here this evening, and you have all kindly given your time to be here tonight. Please be respectful of everyone's time and contribution. As part of that, I ask that aside from the speakers, everyone please keep their video off and their audio on mute until the breakout sessions at the end. We will take one question per speaker after each speaker has done their presentation. Please put your questions in the group chat and we'll select the question from there. All remaining questions will be given written answers and sent out to you after the forum. And just to let everyone know, this session is being recorded. Without further ado, I would like to take the pleasure of introducing you to the amazing Associate Professor Faye Johnston. Faye is a public health physician, environmental epidemiologist, and a chief investigator at the Centre for Air Pollution, Energy, Health and Research, providing us with an overview of the effects of air pollution on health, with particular reference to bushfire smoke and the potential interactions between air pollution and COVID-19. Thank you, Faye.
Thank you. And thank you for having me. I'll just share my screen. There you go. I think you should see a slide now. So thanks. I got asked to cover a range of topics in 14 minutes and I'll do my best to be brief and cover them all. I thought the most important thing was to go over the basics of understanding air pollution. How it works to make people unwell and how that plays out with individuals and populations. And I'll talk a bit about the emerging evidence with COVID-19, which I've got from the literature. I haven't done any research directly on that myself. And if there's time at the end, I'll be able to quickly tell you the results of a health impact assessment we did for Australia of the Black Summer bushfire smoke. So to get into... Okay, I don't know if you can see the titles, actually mine are obscured by the Zoom headings. But just to begin at the beginning, I'll talk about what is smoke and what are combustion emissions. And at the very basic level, I'm sure most of you know this intuitively, but really smoke is what happens when you combust a hydrocarbon. So the hydrocarbon could be a log, it could be a lump of coal, it could be gas, it could be plastic. But basically there's a process of adding heat, which is pyrolysis, which causes it to break down and give off some gases. then with some energy and oxygen, it all oxidizes and burns. You get a lot of energy emitted. And if the combustion is 100% efficient, all the carbon in your hydrocarbon, your log of wood or your lump of coal, will have turned into carbon in CO2, and there'll be water vapour. That's if it's 100% efficient, which of course we know it never is. And it depends on what's burning and the circumstances in which it's burning. But there is always a whole lot of other stuff produced. And really, when it comes to air quality and health, the CO2 is crucially important for the carbon balance, for climate change, carbon accounting, and all the other stuff, which I'll describe in a moment, is what's important for human health. So you can represent that schematically across the top. I've got some examples of hydrocarbons: grass or forest, peat, brown coal. We can go on to gas and other hydrocarbons. You get combustion, and then that would depend on what's burning, how moist it is, how much oxygen there is, the temperature at which it burns. There's hundreds upon thousands of chemical reactions, so smoke is always changing. But in general, with smoke, you always get the similar suite of chemical byproducts as a part of this, and that's what's listed across the bottom. So the one that's circled on the left is particulate matter, and that's tiny suspended elemental carbon, organic carbon molecules. So aerosols and solids that are suspended in the air, they come in a range of sizes, and the smaller the size, the more important for health. So if I say the word PM 2.5, I'm meaning particulate matter less than 2.5 microns in diameter, a micron being 1,000th of a millimetre. And then there's organic acids, hydrocarbons, organic molecules, and sometimes metals, depending on what happens to be burning. And all of the ones I've got listed here have got human health impacts, but in general, particularly with bushfire smoke, particulate matter is what's easily measured, and that's taken as a marker of the entire mix. There's other sources of particles: dust, salt, fertilizer, organic aerosols. You know, gum trees give off a lot of compounds that turn into particulate matter. But when we're measuring it, the health implications of particles, whether they're from combustion or not, tend to be similar. Less is known about sea salt in particular, but in general, taking the massive particles in the air is a good indicator of what the likely health impacts will be. So just a take-home message with smoke toxicity: it's a bit counterintuitive. What burns is important, whether it be a log of wood or a lump of coal, but how it burns is actually more important. And if I was given the choice, so catalytic converters vehicle exhaust is actually reasonably efficient compared with a bushfire or a peat swamp or a coal mine fire. With a lot of smouldering, you get a lot more particles and you get many, many more other chemicals. So if it's 50 micrograms per cubic metre of one versus the other, the one that's going to be more worrying to me for my health will be the burning peat or log rather than the vehicle exhaust. So what happens next? We've got all these particles, they're suspended in the air, and then they cover big populations. So smoke is something we live with, and we all breathe it from time to time. It's kind of part of being Australian. And what does it do when we breathe it? And at an individual level, smoke causes trouble, not so much because it's a nasty poison like cyanide or carbon monoxide, where it's very predictable when you'll get sick and when you might die from that. With smoke, it's more of a stress. It causes immediate changes. Your body recognises that there's foreign material and it mounts a defence response. So it's your immune response, like inflammation, like coughing, and a stress response that makes your blood a little bit more likely to clot, your glucose a little bit higher, and if you've got diabetes, less well controlled, your heart going into slightly more stressed rhythms in the way it beats. So it's these small changes is how smoke causes health harms. In healthy people, you can measure it with lab tests and various studies. These are photos from various studies I've done over the years, including on myself. You can measure these things. If you're healthy, it actually doesn't matter that much. You can take these things, the smoke will go away, it will settle down, a bit like if you're stressed for an afternoon, your heart rate will go up, you'll get a lot of similar changes, and then it will settle down again. But what about individuals? And really, there's an awful lot of people in the community, probably half the community do have a risk factor of some sort that makes them more vulnerable to smoke. And the biggest and most important group is anybody who's got a chronic disease, especially lung disease. And with bushfire smoke, probably because all those other co-pollutants go in the smoke plume, equal amounts of particles that come from vehicle exhaust, for example, compared with bushfire smoke, the impact on people with asthma is far higher. So we know how much generally PM increases presentations for asthma and for a whole lot of other things. If it's bushfire smoke, the source of that PM, it will be an even bigger effect on people with chronic lung disease because you breathe it straight in. It's right, and it's highly irritating, and a lot of those pollutants are very irritating. But it could also be you're at very high risk of a heart attack for whatever reason, your genetics, smoking, whatever has put you at high risk. Having those particles in the air, which might just tip the balance to make your blood slightly more likely to clot, it can be the precipitant of a severe heart attack, like a cardiac event or cardiac arrest. So they're two other outcomes, much less common, much more severe, but can also be precipitated by air pollution. Younger age is a risk factor because organs are developing, young children are still growing, and we know that pollution, living with a smoker, air pollution from traffic can all influence the development of heart and lungs. Older age, reduced organ system function and a much higher prevalence of other kind of chronic diseases, and any sort of socioeconomic disadvantage for a whole lot of reasons. Access to health, poorer health, ability to manage and understand what to do at the time. A whole host of reasons go together to make being disadvantaged a health hazard in many respects, including air pollution. So my take-home message really about smoke toxicity is that with individual health impacts, the amount of pollution is important. The more the pollution, the greater your body's response and the greater the health hazard. But individual susceptibility is far more important. It's a stress, and it's people with underlying risk factors and susceptibility that will always bear the brunt of health impacts of smoke pollution. Long before any people without risk factors will. And that will happen at quite modest, small rises in air pollution. You don't need to wait for a severe event, for example, for someone with asthma to notice what's going on. So this is the famous air pollution pyramid, and really it's a schematic diagram that explains the relationship between the number of people exposed to pollution and the amount of pollution, and the kinds of outcomes you will see if you look at a whole of population level. So the background is Sydney under a smoke plume. You can see 5 million people being exposed to smoke, and all of those 5 million actually will have those physiological changes that I described. Only some of them will get symptoms, and of those, some will need to see a doctor, some might go to hospital, and some might die. Death is actually a very rare outcome, but when a lot of people are exposed, there's going to be enough people in a very high risk group that there will be some deaths. If there's a plume of smoke pollution over Sydney for a day that causes an exceedance of the air quality standard, we know there will be likely a death or two. If that goes for 10 days, 10 times as many. If it's 10 times as high, 10 times as many. It's a fairly linear, straight line response. And so just to give you an idea of the sort of relative amount, if you take, for example, a hypothetical population, say you've got 1 million people in a city, and say we've got an exceedance of the air quality standard for a day, so it's gone over 25 when background might be nearer 5. So that's a modest rise in air pollution. You might not get a death, or you might get 1 or 2. Things like admissions to hospital, emergency presentations and ambulance call-outs, you'll probably count in the tens. Things like GP visits, puffer sales for salbutamol for asthma, you'll probably count in the hundreds on this hypothetical day. And symptoms, you will count in the thousands. Smoke is very irritating. Everybody can feel the symptoms, eyes and nose and irritation of those parts that have direct contact with the pollution. So the bottom line on population level impacts is that the amount of pollution is important. But the number of people affected is actually more important, because the greater the population, the greater the number of high-risk people where you'll see health impacts. And in fact, really extreme pollution is quite rare. So it's what happens every day, and the more modest pollution that at the end of the day is going to be what's driving our population health with respect to air quality. Okay, so that's the background. Just briefly, COVID-19, and what do we know about air pollution and smoke pollution and infections? And from studies, there's been one or two of bushfire smoke in other countries, but certainly from studies of passive smoking, exposure to tobacco smoke in the home, for example, studies of traffic pollution and other sorts of air pollution, we know that it irritates the lungs, we know it causes inflammation, we know it changes immune function and increases susceptibility to respiratory infections. So say as an example, kids who live with someone in their house who smokes are more likely to get coughs and colds and respiratory infections in early childhood. It's a time that those things are very common, but there's biological reasons why exposure to air pollution will increase your risk of getting infections. And there have been a whole lot of recent publications, some fully published, some as preprints, that have looked at associations between air pollution and the rate of population infections with COVID, the rate of being admitted to hospital, and death rates. And these were actually summarised in this very recent Buskar et al. Paper, and it's available on a preprint. And the next slide shows the studies they found. These ones called long-term studies are actually looking at a few weeks before and a few weeks after during pollution episodes and comparing either admissions with COVID or deaths with COVID. And the ones on the right looked at daily air pollution and daily counts of various outcomes with COVID. And I think there were about 25 studies in total. So we've got the number of papers on the left, and across the bottom are the various different types of air pollution that have been looked at. So nitrogen dioxide particles, sulfur dioxide, carbon monoxide, ozone, aerosols undescribed, air quality indexes. In general, there seems to be associations found in most papers, which would fit with what we'd expect. The people of this review of studies were very clear that a lot of the studies were done in a rush because they had to be. We're still in the emergency. So there's lots of technical limitations to many of these studies. But nevertheless, the pattern fits what you would expect. Sarah Henderson did a study where she took the amount that COVID was associated with increased infections in China, applied it to a smoke event in New York, and said, well, what if New York's smoke event coincided with New York's epidemic of COVID? And she kind of worked out if the two had come at the same time, perhaps the outcomes from COVID would have been about 10% worse in terms of hospital admissions or deaths. Okay, that's modelling, but it sort of gives a ballpark figure of what these studies seem to be implying. So air pollution is likely to be a risk factor, but I think we need to keep in contact. Many other risk factors are probably more important for COVID. Underlying chronic disease, crowding, all sorts of risk factors that we're all working very hard to address. So it's one of the things in the smoking, of course, living with a smoker, much stronger signals than ambient or outdoor air pollution. Okay, so how am I going for time, Kate? You're muted. Shall I keep going?
We've got about 30 seconds.
Okay. I might just show you the results slide then. Nicholas Borges, highlighted here, is PhD student of mine, looked at the air quality throughout Australia during the fires and did what's called a health impact assessment, where you take the amount of pollution, the population, death rates, admission rates, apply a known multiplier that you take from the literature, apply an agreed value that you take from agreed studies, and worked out impacts of the fires. But we've only got good data about deaths and hospital admissions, so this doesn't include what is in fact the bulk of the impacts in the community: mental health symptoms, missing school and work. But if you just take deaths, hospital admissions for heart and lung diseases and asthma presentations, and this is all of Australia. The figure that we got for deaths, for example, came from about a bit over 400 additional deaths due to the smoke, and about 1,500 additional asthma emergency attendances, and around $2 billion. And this, I'll finish on this slide. This shows you, I don't know if you can see the end. Oh, I can move the Zoom meetings. This shows it year by year and by state for the last 20 years. So Victoria is coloured orange, and you can see that, of course, last summer was the biggest year ever for health impacts from bushfire smoke. This figure relates only to excess pollution from bushfires, not from other sources of pollution. So I better finish there, and maybe we'll do questions later. Thank you, Kate.
Thank you so much, Faye. That was very informative. We don't have any questions at present, but if anyone thinks of any questions for Faye, please put it in the group chat and we'll get back to you with written responses. So it's with pleasure I'd like to introduce you to Rose Bell, Research, Information and Evaluation Coordinator at Asthma Australia, sharing with us some asthma statistics in Gippsland and the results of Asthma Australia's survey of people's experiences during last summer's bushfires, with particular reference to Gippsland. Thanks very much, Rose.
Thanks, Kate. I'll just share screen now as well. Let me know if you can't see that. To start with, before I jump into the bushfire smoke survey, I did just want to share some statistics that are available around the prevalence of asthma in Gippsland. This is from the Public Health Information Development Unit at Torres University, and you can see that it's quite a bit higher in all around Gippsland compared to areas in Victoria and Australia more broadly. I don't have much time to touch on that much more, but I just wanted to share that before I got started. What I do want to talk about today is the impacts of bushfire smoke, particularly on people with asthma during the 2019-2020 bushfire crisis. So as the leading consumer organisation for people with asthma, it was really important for us to understand during this time the experiences of people. We were already seeing a significant increase of calls to our helpline during this time, but we really wanted a way to understand more broadly the impact that people were facing and broader on than just their health as well. So we launched a survey in December, which was open for 6 weeks and had qualitative and quantitative questions. Based on a previous survey we'd done after the 2016 thunderstorm asthma event, we had benchmarked it hoping for around 3,000 responses. And we were completely overwhelmed where at that 6-week period, we had more than 12,000 people had responded to the survey, which immediately highlighted the significance of the smoke impact. It was mainly people with asthma and their carers, but we still did have 40% of people with no diagnosis of asthma experiencing the impacts of that smoke and wanting to share their experiences. And you can see there that about half of the respondents were people from New South Wales, but also quite a lot from Victoria and ACT. We worked with some researchers to distill these results into 6 key findings, which I'll go through. And I think you'll note the first 2 are not particularly surprising, particularly after Faye's presentation. But we did, of course, see that people with asthma were significantly more impacted. So nearly all people with asthma reported that they experienced symptoms during the bushfire crisis, although interestingly, it was really high for people without asthma as well, at about 70%. But people with asthma were much more vulnerable to this serious health complications. So 4 times more likely to report attending the ED or being hospitalised, and 7 times more likely to require oral corticosteroid medication, which is needed for severe asthma flare-ups. And these were consistent in Gippsland area specifically as well. Also, which Faye has touched on, was that children and young people were particularly vulnerable. So children or carers of people aged 0 to 17 did tend to report less symptoms, but they were much more likely to report visiting their GP, attending the emergency department, or being admitted to hospital compared to other age groups. Parents also reported schools not being adequately equipped to manage the periods of smoke exposure, or as you can see on the screen there, a large number of children being kept home from school to try and avoid the smoke. Further to the physical impacts was the significant toll on mental health. This wasn't actually something that we asked about in the quantitative questions, but it just came out so strongly in people's open text responses. They spoke about feeling sad, anxious, depressed, helpless, and this was both increased symptoms of pre-existing mental health conditions and also new symptoms that people were experiencing because, of course, of the direct impact of the bushfires and the smoke, but also because they weren't able to do things like go outside or exercise, which might be activities that they would usually do to manage mental health symptoms. And I'd just add that as someone who read through a lot of these responses, it really did paint a picture of just how helpless people were feeling during this time of being able to avoid the smoke exposure. And of course, coupled with that, particularly in Gippsland, people directly fighting fires as well. The fourth and fifth key findings are what I touched on earlier about really wanting to explore the impacts broader than those physical impacts on people's health. So we found that, of course, the smoke resulted in people not being able to participate in their everyday lives, so reduced capacity to work, to just do simple everyday activities like take their dog for a walk, tend to the garden, grocery shopping, without putting themselves at risk in the smoke. 35% of people with asthma reported missing an important sporting or social engagement, and 29% reported absences from school or work over that time. And again, all these outcomes were more significant for people with asthma. Likewise, we found that there was a large impact on people's financial well-being, and again, more significant for people with asthma. 1/4 of people with asthma reported financial strain due to things like extra doctor's visits because they were unwell, needing additional medication like oral corticosteroids, or buying protective equipment like masks and air purifiers. And also 10% of people said that they experienced lost income during this period for needing to stay home from work. Unfortunately, some people reported that they were unable to take action to protect their health due to the costs as well. And finally, most importantly, and probably most surprisingly from our survey, was that we found the public health advice, which aimed to minimise the impact of smoke exposure on health, didn't appear to help during this crisis. So we asked people with asthma about what actions they took before the bushfire period, things like going to see their doctor for an asthma review, taking their preventer, registering for air quality alerts. And we also asked all participants what steps they took during the bushfire smoke once they were exposed to smoke to minimise. So the sort of standard things like staying inside, keeping the doors and windows closed, using a mask, things like that. And we found that people who reported that they took steps to minimise smoke impact both before and during the bushfire season were still more likely to report respiratory symptoms, require medical attention, and experience negative impacts on their quality of life than people who didn't take steps. Of course, there's a lot of nuance to that. There's a lot of limitations in the nature of doing a survey, and we're not suggesting from this that the steps put people at risk. However, these results, these findings, and the depth of the responses that people provided in the survey just told us that it didn't matter what people did. Despite their best efforts, the smoke was present for so long and at such high levels that it was just out of their control to protect themselves. There's a couple of quotes up here which just sort of highlight the myriad of challenges that people face trying to avoid or minimise their smoke exposure. People talked about that it was there for so long, even if they stayed inside, the smoke would penetrate their homes anyway. Air conditioners, if they didn't have one with a recirculate setting, would bring in the smoky air anyway. The cost of protective methods, which I've sort of touched on, use of air conditioners, air cleaners, face masks, challenges accessing masks for young children, and also the lack of clear guidelines and policies in place in workplaces and schools to protect people when they were there. Overall, the survey just highlighted the far-reaching impact of the bushfire smoke and the need for better protection, particularly for our vulnerable community. So we did distill this into 10 key recommendations from the survey, which also forms part of our broader policy platform around air quality. And we have begun having discussions with all levels of government and different stakeholders to brief them on the survey and what we're calling for to help people with asthma and the broader community. If you want to read the full report, because obviously it's hard to get through everything there, you can find it online, which also has detail about our recommendations, or you're welcome to contact me. And also just a thank you to Sharon, Din, Shamali and Amy, who were the researchers who completed the analysis for us.
Thank you so much, Rose. That's fantastic. We have a question from the floor from Wendy. Why do you think asthma is at a higher rate in the Gippsland area?
I'm not sure, to be honest, Wendy. I think that it's really complex. Asthma itself is a really complex issue, and I think there's lots of things that could be contributing to that, but I'm not sure that I could list them all. I mean, things like higher smoking rates could. I'm not sure what the smoking rates are in Gippsland, but yeah, certainly quite a variety of things.
Good question. We're going to keep things moving along fairly rapidly. So thanks, Rose. Next we have Harry. Dr. Harry Jennings is a GP and co-founder of Healthy Futures, an organisation of healthcare workers working to address the environmental determinants of health. Harry will provide some information on air quality and health in Gippsland and opportunities for advocacy. Thanks, Harry.
Hi everyone, I hope everyone can hear me. If not, please put it in the chat. I'm also conscious we're a bit behind time, so I'm going to try and be quick. So I'll just share my screen. Just a moment. Yeah. Okay. And present that. Right. So I just wanted to speak a little bit about what we do know about air quality in Gippsland and some ideas about things we can do about the air quality and its health impacts. So our knowledge of air quality in Gippsland is limited to where we can measure the pollution. And I think all of EPA Victoria's monitoring stations in Gippsland are in the Latrobe Valley, which makes sense because that's a major population centre, but it means we have little information, relatively speaking, about the air quality and potential health impacts in other parts of Gippsland. So the first part of my talk will focus on the Latrobe Valley, but then I'll talk about some other Gippsland issues as well. The picture here is just the monitoring stations around the valley from the EPA Airwatchers website. But I'll keep going. So what we can obtain the air quality data from those monitoring stations in the Latrobe Valley, and I've calculated an average concentration of PM 2.5s in the air at those monitoring stations for all of 2019. You might remember Faye mentioned that PM 2.5 is particulate matter, less than 2.5 microns in diameter. So that's about less than 1/30th of the width of a human hair. And those particles can get into lungs, be absorbed into the bloodstream and cause various health problems. So I've graphed here the annual averages for 2019 at those monitoring stations. In global terms, these aren't high levels of pollution, but there is increasing evidence that even these relatively low levels of pollution can still cause harm. So I'll go to that next. This graph is an excerpt from a study published in 2017, done in the United States, including 60 million people aged 65 and over. And they found that even at low levels of particulate matter exposure, risk of death increased. So compared to people who were exposed to just 5 micrograms per cubic meter of PM 2.5 over a year, if their exposure compared to those people who are exposed to 8 micrograms per cubic meter had about 2% increased risk of death. And then the people exposed to 10 micrograms per cubic meter of PM 2.5 had a 4% increased risk of death. And this is just one sort of study. There are many, many studies out there showing different connections between different pollutants and different health outcomes. But I just wanted to include this to illustrate the scale of harms that could be attributable to air quality. And I've mapped in this next slide the average pollutant concentrations of PM 2.5 from each of those valley monitoring stations over last year, just to give you a sense of what impacts those levels might cause. if this concerns you, you might be curious to find out where the air pollution is coming from. So this graph is from the Hazelwood Mine Fire Inquiry 2015-16 report, and it was drawn from a submission by EPA Victoria to that report that estimated the contribution of different pollutant sources to the Latrobe Valley airshed. So they've got 5 pollutants along the bottom row here, and the light blue column that covers most of those, the light blue area that covers most of those columns is attributable to electricity generation, which I think would be all coal-fired power. In the case of carbon monoxide, the leftmost column, there's still substantial contributions from log sawmilling and timber dressing in orange, and then the vehicle emissions in the light sort of aquamarine color here. But for most of the rest, it has been attributed to coal. And in terms of coal specifically, some of you may be aware that yesterday a report came out that was commissioned by Greenpeace that estimated the health impacts of coal-fired power across Australia. The report estimated health impacts by state, but the researchers have also sent through some unpublished data estimating health impacts in local government areas. So their estimates for the Gippsland local government areas are here. On the left-hand side, they estimated that coal pollution accounted for premature deaths each year of this order, between sort of 0 to 16 or up to 30 potentially. Those black lines there are confidence intervals of 95% confidence. So the researchers essentially are 95% sure that the true rate is within those 2 bounds, if that makes sense, for each parameter, based on their modelling. The middle graph shows low weight births attributable to coal-fired power each year. And then the right-hand graph is a little bit of a complicated statistic, but it's person days of asthma symptoms for children aged 5 to 19, or number of times that a person with asthma or a person experienced asthma symptoms in a day each year. I don't have time to go into the methodology of the report, but we can provide that information after this event. And just on sort of the pollution from coal-fired power, this graph shows how the regulations setting limits on pollution for power stations in Australia lag behind regulations for other coal-fired power stations in other parts of the world. It's from a report by Environmental Justice Australia from 2018. And the original table includes all the power stations around Australia. This one, in the bottom half of the screen, you can just see the pollution limits for the Latrobe Valley power stations, and you can compare those to the limits in the United States, Europe, and China. I've just made a small addendum or annotation to this graph on the left-hand side in red, because the European Union has recently adopted more stringent standards that are going to come into force next year to ensure that coal-fired power stations there pollute no more than 8 milligrams per cubic metre of particulate matter, which is far less than the Australian power stations are permitted to pollute at the moment. And that is by requiring those power stations to install technologies like bag filters and other things to reduce their pollution. So in terms of what we can do, just briefly, Healthy Futures has formed a new group called Healthcare for Clean Air Gippsland, which is health workers and health science students around Gippsland working to find out more about air quality and health and take action to address it. If you're interested, please send me an email. We've got a page in our website where you can also write to the EPA regarding coal, and the link is there too. And then finally, I just wanted to shout out quickly to another new group called Communities for Clean Air, which is focusing on the health impacts of wood heaters. And there's an email there that you can contact them on. All these slides will be going out after this event, so you don't have to write down things frantically. Thanks, everyone.
Thanks, Harry. Fantastic. Lots of information there. There's a question I have here. Is it likely that someone could also study the impacts of government planned burns each year? Do you think health impacts and deaths would be the same or similar as bushfires?
That's a really good question. The short answer, I imagine it would be possible to estimate the pollution from those sources. And in fact, looking at that graph that the EPA submitted to the Mine Fire Inquiry a few years ago, there is a small percentage accounted to sort of landscape emissions. And I wouldn't expect that to be as large as the pollution from bushfires just because of the size of the areas burned, but I'd have to look into that and get back to you. So thanks for the question.
Okay, Thank you very much. Now I'd like to warmly welcome Associate Professor Tony Sasse, a respiratory physician in the Latrobe Valley, who will provide us with a reflection on the issues raised so far on his local clinical experience. Thank you, Tony.
Thank you very much. I'm trying to find the screen, but I'm just going to talk to you direct. So I'm a clinician. I've spent 30 years seeing respiratory cases in Traralgon. Used to run the intensive care for a little while, and you get impressions over a period of time. There's no doubt in my mind at all that during high smoke periods such as bushfires, or particularly during the Morwell mine fire, the incidence of respiratory illnesses just skyrocketed. There were many more cases, patients presenting to their GPs, to their specialists. Furthermore, there were some serious injuries as well. There was a famous case of pulmonary fibrosis from a worker in the mine fire, which went through the court in Morwell just recently. Some of you may have heard about that. And also I've seen a case of multi-chemical sensitivity syndrome as a result of the Morwell mine fire smoke. So there's no doubt that smoke toxicity is a very important part of our life in Gippsland, unfortunately, and anything that we can do to try and remove, alleviate or prevent that would be terrific. When patients come in, the simplest things that we do are basically, the first thing is to try and minimise your exposure, of course. Anyone who's smoking is strongly advised to stop smoking. I was particularly taken by the comment that patients with underlying lung diseases are more susceptible to smoke damage, and there's certainly no doubt about that. Many patients find that air purifying devices are extraordinarily helpful. Patients often buy two of them, one for the lounge room and one for the bedroom at night. It's really important that patients also minimise their virus exposure, something we're all very familiar with right now, because if you have a combination of a smoke event and a virus event, it is really quite something. Patients usually require increased medication needs. This can, of course, lead to expense issues and other things like that. But often patients have to double or triple their inhaler usage. So I want to keep my comments short. If anyone's got any questions, that would be fine. The other thing I'd just like to mention is that there are other sources of sulfur dioxide in Gippsland. The paper mill used to put out quite a lot of SO2. You can still smell it yourself sometimes downwind in Traralgon. So it's not just coal and bushfire smoke, but there are other sources of air pollution too. Thank you.
Thanks very much, Tony. So I'd like everyone to put your virtual hands together for our speakers tonight. Thank you, Associate Professors Faye Johnston and Tony Sasse. Thank you to Rose Bell and Harry Jennings. The forum was made possible by the collaboration between Asthma Australia, the Lung Foundation and Healthy Futures. Asthma Australia is Australia's peak consumer body for people living with asthma, providing a variety of services, research, resources and advocacy. The Lung Foundation Australia is the only charity and leading peak body in Australia that delivers life-changing research and programs, supporting and providing hope to people of all ages with a lung disease and their families. I'm from Healthy Futures, which is an NGO of healthcare workers and community members to address the environmental determinants of health. Please find out more via our websites. A reminder that tonight was just an introduction to a very complex issue. Taking action is what will consolidate your learning and create meaningful outcomes. We're proponents of learning on the job, so here are a few ways that you can get involved. One is to sign the open letter to the EPA asking for pollution controls in line with recently adopted European standards via the Healthy Futures website. Attend a Healthcare for Clean Air meeting. Our next meeting will be in September. We'll email out a poll to pick a date for this event. And if you can follow us on social media, likes and shares mean that we reach a larger audience and can find new volunteers. And reaching out to other groups also working on this issue. It's important that we are a collective voice. We've got Communities for Clean Air, working on the wood fire smoke, Asthma Australia, the Lung Foundation, and Voices of the Valley. Please take a moment to fill out the survey via the link that you can see. This is really important for us to work out how we can best work with each and every one of you. And please don't hesitate to contact us. We'd love to hear from you. Together we can achieve improved air pollution controls in Gippsland and live in a healthier world, and that's what we all want tonight. So thank you everyone so much for your time, and have a good night.